This is for the career profile number 2, and I decided to do a licensed marriage and family therapist because that's a very typical job to think about in this field to go into. Let's see, first of all, they are found in both small and large organizations, and you can find them in day treatment programs, public or private practice, or in community health organizations. They typically see the clients at an office during the day, but they can also provide assistance at various locations within the community. There's a little bit more stable hours for this job, but it also requires flexibility from the employee, especially if they're going to teach some classes or if they need to get continuing education credits. One of the good points is that there's higher flexibility in this job in that the employee can use their specific training to help individuals in the way that they feel is best. And so they feel there's a lot of personal independence with this job. On the other hand, it is considered a very high-stress job because you are dealing with different individuals, couples, and families that are dealing with issues and high conflict situations. And there's also pressure to meet some strict deadlines. So therapists say that they tend to feel a good amount of stress from this job. Some of the typical benefits that I've seen for a marriage and family therapist that works full-time, they get medical and life insurance, different health benefits, paid vacations and holidays, sick leave, a retirement plan such as the 401k, and there was one that had a thrift savings plan. So that seems like a very decent amount of benefits for that job. Some of the common tasks for a marriage and family therapist includes aiding and treating clients through mental and emotional issues through the family systems theory, principles, and techniques. They can help them modify a client's behaviors and their perceptions by using that process. They increase the understanding and communication within families and couples and try to help avert crises on the family and individual level. They'll listen to clients and teach skills that they need to deal with a range of complications, including substance abuse, other crisis situations, and sexual abuse. A lot of times they'll cooperate with other psychiatrists or family physicians and social workers so that they can establish the ideal treatment option. They can also teach classes on topics like interpersonal relationships and perform research. They have to follow and honor the code of ethics that's defined by their specific certification or license. For this job, you do need a higher degree. You'll need a bachelor's degree in an area like marriage and family therapy, education, agency or community counseling, or career counseling. Then they also require a master's degree that will help the therapist learn how to identify symptoms of emotional and mental disorders and to provide effective treatment. They'll need a license, either a national or state license, whatever they need, and that's usually they need to pass an exam, and it requires either like 2 years or an additional 3,000 hours of clinical experience outside of schooling. There's also continuing education credits that need to be completed once they're in the job. And obtaining a higher degree than that can be very beneficial in that area, especially if they're going to go into research. The starting salary range is about $35,000, and the experience went up to close to $60,000, depending on location. And it seemed that between individual and family services, office or other health practitioners, outpatient care centers, local government, and state government, the highest average paying was through the state government for this field. And lastly, just one suggestion that one therapist had was, before you get into this field and really start trying to help other people, you need to make sure that you have your own life in order and that you clear up any unresolved issues that might get in the way of your practice and kind of have that solid foundation. And that's it. Thank you.